Did you know that 68% of Americans over 50 suffer from chronic bone and muscle pain? And the most shocking part? Much of this pain could be avoided with simple dietary changes. You heard that right. That little backache you think is just old age, or that nagging leg fatigue. It might be what's on your plate or in your cup. Let me tell you a story that really stuck with me. Mrs. Gladys, a 62-year-old woman, came to my office almost without hope. She could barely climb stairs, had constant knee pain, and a fatigue that no medication could touch. "Doctor, it's just old age catching up, isn't it?" she asked, resigned. But it wasn't. After a detailed look at her diet, we discovered she was eating at least 5 of the foods I'm going to reveal today. Real villains disguised as harmless snacks, literally leaching calcium from her bones and inflaming her muscles. What happens is that some seemingly healthy foods can have a devastating effect on your musculoskeletal system. They increase the acidity in your body, forcing it to use minerals from your bones to neutralize that acidity. It's like your bones are being robbed from the inside out, day after day, cup after cup, bite after bite. And listen up. I bet you've had at least one of these villains today. Maybe you're even having one right now as you watch this video. But don't worry. By the end of this presentation, you'll know exactly which foods to eliminate or reduce, and more importantly, what delicious alternatives to replace them with. I'm Dr. Alexander King, a specialist in orthomolecular nutrition, and your guide to a life with more strength and less pain. Let's start by talking about the villains that come disguised in liquid form. First on our blacklist is coffee. Yes, that cup of joe you have every morning that seems so harmless. Studies at Harvard University show that excessive caffeine consumption, more than 3 cups a day, can decrease calcium absorption by up to 15% and increase its excretion in urine. The mechanism is simple. Caffeine interferes with your intestine's ability to absorb calcium from food. Plus, it has a diuretic effect, causing you to lose more calcium through urine. It's like you're literally throwing away the raw materials for your bones. The second liquid villain is soda, especially cola-based drinks. They contain phosphoric acid, which binds to calcium in the digestive tract and prevents its absorption. A study from Tufts University found that women who drank cola-based sodas daily had 4% lower bone density in their hips compared to those who didn't. And don't think that zero or diet sodas are off the hook. Their acidity is even more harmful to bones. The phosphoric acid in these sodas has a pH of around 2.5. To give you an idea, that's almost as acidic as stomach acid. During a recent consultation, I met Mr. Robert, 57, who had been drinking an average of 1 liter of soda a day for over 30 years. When we performed a bone density scan, we found advanced osteopenia, the stage before osteoporosis. After 6 months of replacing soda with lemon water and natural teas, the exams already showed a significant improvement in bone health. Another dangerous drink? Alcohol in excess. More than 2 drinks a day directly interferes with bone formation by inhibiting osteoblasts, the cells responsible for building bone tissue. It's like you're firing the workers who build the structure of your bones. Do you usually drink more than 3 cups of coffee a day? Have you noticed any difference in your joint pain when you reduce your coffee or soda consumption? Think about it. And what would be the alternative to these liquid villains? Water. Simple as that. Pure water, or water enhanced with fruits, caffeine-free herbal teas like chamomile and lemon balm, and natural unsweetened juices. One recipe I recommend to my patients is water with lemon, ginger, and a little honey. Besides being tasty, it has anti-inflammatory properties that benefit the muscles. Now let's talk about the most common villains on supermarket shelves, ultra-processed foods. And here's the first food I promised to reveal at minute 3 of this video. Processed meats. Ham, bologna, hot dogs, bacon, and sausages contain high amounts of sodium, preservatives, and nitrates that promote inflammation in the body. A single slice of ham can contain up to 300 milligonallers of sodium. Excess sodium in the diet increases calcium excretion in the urine. It is estimated that for every 2.3 g of sodium consumed, we lose 40 mg of calcium. In addition, the nitrates and nitrites used as preservatives in these foods are converted into compounds called nitrosamines, which can damage cells and generate more inflammation. The second villain in this category is packaged cookies and other processed sweets. They contain excessive amounts of trans fats and refined sugars, an explosive combination for the health of bones and muscles. Trans fats increase inflammatory markers in the blood, while excess sugar increases the acidity of the body. Remember the case of Mrs. Gladys I mentioned at the beginning? One of the main villains in her diet was precisely the cookies she ate daily, with her afternoon coffee, thinking that because they were light, they wouldn't do any harm. She was eating an entire package of cookies a day. The third villain in this category, and this may be the most surprising, is some fitness products and granola bars. Many are sold as healthy, but in reality, they contain large amounts of sugar, high fructose corn syrup, and preservatives. A study published in the International Journal of Endocrinology revealed that foods with a high glycemic index can increase the production of inflammatory cytokines, substances that promote inflammation in tissues, including muscles and joints. Do you usually check the labels of the foods you buy? Have you noticed the amount of hard-to-pronounce ingredients present in many healthy products? The alternative to these processed villains? Whole and natural foods. Replace ham with homemade turkey breast seasoned with herbs, packaged cookies with dried fruits, nuts, or homemade cake made with natural ingredients. And remember, the fewer ingredients on the label, the better the food usually is. Now let's move on to a category that surprises many people. You probably grew up hearing that milk is good for your bones, right? But the truth can be more complex. Milk and its derivatives, especially the fattier ones, can be problematic for some people. That's because about 65% of the world's population has some degree of lactose intolerance after childhood. Undigested lactose can lead to intestinal inflammation, reducing the absorption of important nutrients for bones, such as calcium and vitamin D. Also, whole milk contains saturated fats, which, in excess, can promote inflammation. A study published in the Journal of Nutrition showed that diets high in saturated fats can increase levels of C-reactive protein, a marker of inflammation in the body. I was struck by the case of Anna Peterson, 47, who suffered from intense joint pain and swelling in her hands. After completely removing dairy from her diet for just 21 days, she reported a nearly 70% decrease in pain. When she reintroduced cheese, her favorite food, the pain returned in less than 48 hours. As for meats, not all are villains, but some can be problematic, especially red meats in excess. A consumption of more than 18 ounces, approximately 510 gr, of red meat per week is associated with an increase in inflammatory markers in the body. This is because red meats contain a type of fatty acid that can stimulate inflammatory processes, especially in the joints. Another important point, the method of preparation. Meats grilled at high temperatures, especially when they are charred, produce compounds called AGEs, advanced glycation end products, which increase oxidative stress and inflammation. Have you noticed if your joint pain worsens in the days following the consumption of cheeses or a barbecue? Have you tried reducing these foods for a few weeks to see how you feel? The solution is not necessarily to eliminate these foods, but to consume them in moderation and make smart choices. Prefer plant-based milks enriched with calcium, such as almond or oat milk. Opt for less fatty and fermented cheeses, such as cottage cheese or ricotta. As for meats, prefer white meats like chicken and fish. And when consuming red meat, choose lean cuts and cook at moderate temperatures with methods like stewing or braising. Now we come to one of the most controversial villains, wheat and other foods that contain gluten. No, I'm not saying everyone needs to go on a gluten-free diet, but it's important to understand that for many people, gluten can be a potent inflammatory agent, even without a diagnosed celiac disease. It is estimated that about 6 to 10% of the world's population has some degree of non-celiac gluten sensitivity. In these people, gluten consumption can trigger inflammatory responses that affect not only the intestine, but the whole body, including joints and muscles. A study published in the Journal of Nutritional Biochemistry showed that some proteins present in wheat can cross the intestinal barrier in sensitive people, triggering an immune response that leads to the production of pro-inflammatory cytokines. White bread, in addition to containing gluten, is made with refined flour, a simple carbohydrate that is quickly converted into sugar in the body. As we have already mentioned, excess sugar increases the acidity of the body, forcing it to use minerals from the bones to neutralize this acidity. I had a patient, Mr. Paul Miller, 58, who suffered from severe joint pain and diagnosed fibromyalgia. After several attempts with medications that brought only temporary relief, we suggested a 30-day elimination diet, removing gluten. The results were surprising: a 60% reduction in joint pain and a significant improvement in overall disposition. When he reintroduced whole wheat bread at breakfast, the pain returned in less than 24 hours. Pastas such as spaghetti and lasagna, especially those made with refined flour, also fall into this category. They cause blood sugar spikes and increase the production of insulin, a hormone that, in chronic excess, can increase inflammation in the body. Have you tried going a few days without consuming breads, pasta, and other foods with gluten? Did you notice any change in your level of pain or in your disposition? What is the solution? It is not necessarily to completely eliminate gluten unless you have proven sensitivity or celiac disease. But reducing your consumption and opting for alternatives can make a big difference. Try naturally fermented breads, sourdough, which are easier to digest, or gluten-free options such as cassava bread, tapioca, and rice. For pasta, there are great alternatives made with chickpea flour, rice, or lentils. Now that we know the villains, let's talk about the heroes of our story, the foods that can help strengthen your bones and muscles, reduce inflammation, and even reverse some damage. The main concept here is the acid-base balance of the body. As I explained, many of the villain foods increase the acidity of the body, forcing it to use minerals from the bones for neutralization. In contrast, alkalizing foods help maintain a balanced pH, preserving bone health. Dark green leafy vegetables are the champions in this category. Spinach, kale, arugula, and broccoli are not only alkalizing, but are also rich in calcium, magnesium, and vitamin K, essential nutrients for bone health. 3.5 ounces, approximately 100 grams, of kale, for example, contains approximately 150 milliliters of calcium, which is 15% of the daily recommendation of this mineral. Fruits, especially citrus fruits, despite having an acidic taste, have an alkalizing effect on the body after digestion. Lemons, oranges, and tangerines are rich in vitamin C, essential for the production of collagen, the protein that forms the structure of bones and cartilage. Seeds and oil seeds also deserve mention. Chia, flaxseed, almonds, and walnuts are excellent sources of omega-3, a type of fat with potent anti-inflammatory properties. Just 1 tablespoon of chia seeds contains more calcium than a glass of milk. Mrs. Gladys, whom I mentioned at the beginning, started including a green leafy salad and a serving of fruits rich in vitamin C daily. In addition, she added a tablespoon of chia to her morning yogurt. In just 7 days, she reported less swelling in her legs and a much better sleep quality. After 3 months, she was able to climb stairs without pain and had regained her disposition. Another hero food is cold water fish, such as salmon, sardines, and tuna. Rich in omega-3 and vitamin D, they fight inflammation and aid in calcium absorption. For those who do not consume fish, seaweed and ground flaxseed are great plant-based omega-3 alternatives. And we can't forget about turmeric, a spice with powerful anti-inflammatory properties thanks to curcumin, its active compound. Studies show that curcumin can be as effective as some anti-inflammatory medications, but without the side effects. Do you usually include dark green leafy vegetables in at least one meal a day? Have you tried adding turmeric to your dishes? How about starting today? A practical suggestion: start your day with a green smoothie. Blend a banana, an apple, a handful of spinach, a tablespoon of chia seeds, and water. It's a burst of nutrients for your bones and muscles, and the taste of the fruits completely neutralizes the taste of the spinach. We've reached the end of our conversation today, and I hope you've realized how small changes in diet can have a huge impact on the health of your bones and muscles. Summarizing the main points we covered. Then, we met the hero foods, which can help reverse damage and strengthen your musculoskeletal system. Dark green leafy vegetables, citrus fruits, seeds, nuts, cold water fish, and anti-inflammatory spices like turmeric. Remember the case of Mrs. Gladys. She lived with leg pain, tense muscles, and persistent fatigue. She thought it was just old age catching up. But after identifying and replacing the villain foods in her diet, in just 7 days, she already felt less swelling and slept better. In 3 months, she climbed stairs without difficulty and had regained her disposition. And no miracle drug or expensive treatment was necessary, just smarter food choices. I imagine you're asking yourself, where do I start? My suggestion is simple. Don't try to change everything at once. Start by eliminating or reducing one villain per week and introducing a hero in its place. For example, in the first week, replace soda with lemon water. In the second, replace processed meats with homemade options, seasoned with herbs, and so on. The important thing is to understand that your body is incredibly resilient and responds quickly to positive changes. Even if you've consumed these villains for decades, it's never too late to start making better choices. Your bones and muscles will thank you, and you'll feel the difference in your day-to-day life, in your disposition, in your mood, and of course, in the reduction of pain. If this video helped you, please click the subscribe button on the channel and share it with your friends and family. Many people are suffering unnecessarily from pain that could be relieved with simple dietary changes. You can help transform someone's life today. And remember my saying, the most powerful medicine is at the end of your fork. Your daily choices build or destroy your health. The decision is yours. I'm Dr. Alexander King, and I'm here to help you live with more strength and less pain. Until the next video.